There's a new job posting on this Jobs Friday. These three faces, Berkshire Hathaway CEO Warren Buffett, JP Morgan Chase CEO Jamie Dimon, and Amazon head Jeff Bezos have put out the feelers. Now the hunt for the job position of CEO of their new healthcare venture to bring down costs is on. One man who many say would certainly have the resume qualifications and can straddle this very fine line between fixing an out-of-control cost situation while still providing hundreds of millions of Americans with quality, good health care is Dr. Toby Cosgrove, who helped build one of the nation's most prominent hospital chains, the Cleveland Clinic. He joins us in a Fox Business exclusive. Have they called you? You putting in your resume?
Yeah, no, I'm not putting in my resume, and no, I will not be the CEO there. They have, I think, identified the individual they're looking for and probably just about to sign them.
Oh, really? And that is?
I don't know.
Oh, but you've heard that there is a person that they want.
I've chatted with them, yes.
Oh, very interesting. Now, did they ask for your advice? Because you are the man who figured out how doctors should be paid on outcomes versus on how many tests, for example, were ordered.
No, they haven't asked for my advice, but, you know, I've told them that I have tremendous respect for all three of them. I'm delighted that they are raising the idea of the private sector getting into healthcare in a major way. I think they will bring innovation, and because I'm delighted that the half of the U.S. population that is now get their coverage through employment are going to be taking new tax, and I think this is going to be very good for health care as we go forward.
Well, I'm interested to know how they can get this together. Many a very smart individual have tried and failed on this, as you know. Obamacare has evaporated most of it, and then you look at how insurance companies have put dug their heels in, and they constantly want to get paid. Doctors need to get paid for their expertise. There are all kinds of issues here. How are they going to do this?
Well, I think you have to look at what the potential that they can do. First of all, certainly Berkshire, through Geico, understands risks, and I think that one of the things I could imagine them doing is having a mutual insurance fund. And the second things that they can do is they've got 1 million employees that they can cover, and I don't think that I think they're going to boil the ocean to start with. I think they'll start trying to get some early small wins and move on from there. But certainly you've got Amazon also that has a distribution system. Mm-hmm. Big opportunities there, and certainly there's been lots of rumors about Amazon.
Well, what is this person that you say will be signed very soon to do this? What must he or she, is it a man? Can you at least give us that?
I don't know.
Okay. Something tells me you do, but okay, I'm going to believe you, Doctor. What must they do to provide the quality health care when we know one thing for sure? There are a lot of people who are on Medicaid and they need Medicaid. There are others who are on Medicaid and don't want to work, even if they're able-bodied. Got to pay for this somehow, right?
Well, I think what they're looking at is the private sector and people who are employed. This is not including Medicare, Medicaid, and I don't think for a second they're thinking about totally reforming the entire U.S. health care. It is too big. It's the biggest industry in the United States by a lot, and it's growing very fast. And so they are really centered in on one thing, and that's trying to reduce the cost of health care for their organizations. And if they develop things that are going to be helpful that go beyond that, I'm sure that they will try to spread it out across a bigger portion of the private sector.
They say they're not in it for profit. Is that do you believe that? These guys are capitalists, if nothing else.
Well, they may not be in it for profit, but they're certainly in it for savings. And that translates into profits. And they have a lot of employees, and they're interested in saving on the health care of those employees. And, you know, this is possible. We have done this at the Cleveland Clinic, and with some 100,000 of our employees and dependents, we've reduced the cost of health care. It went down 2% last year and hasn't gone up for the last 4 or 5. So this is an important and doable sort of thing that you can do in the private sector. And if you look at about half of the people in the United States are privately insured, and the other half have some sort of government pay. And the government pay has been slow, and it has not moved along very fast, but certainly change is afoot. And it's really driven, if you will, by 3 things. First of all, the escalating cost of health care is going faster than the inflation rate, and it's going for two reasons, really. One is because a silver tsunami of older people, and secondly, there's more things we can do for patients to take care of them. The second thing is that the technology that's coming along is amazing, and we're going to look at big data, we're going to look at machine learning. All these things are going to help us enormously with healthcare. And the third thing is expectations of the population. They want a more efficient, lower cost, higher quality, and more available health care. And all of those things are going to drive changes across both sectors. But I see the biggest change coming in the private sector.
Well, the government hasn't often beat out the private sector in ideas and effectuating these ideas, executing these ideas. I'm hoping these three, among the smartest in business history, can do it. And it sounds like you believe it, too. Toby, thank you.